Most men don't realize their prostate is trying to send them a warning sign long before things get serious. And the problem is, this signal is so common that many men shrug it off as just part of getting older. But ignoring it can quietly lead to bladder damage, infections, and even a much higher risk of prostate cancer down the line. If you've ever found yourself standing over the toilet, wondering why it takes so long to get started, or why the stream feels weaker than it used to, this video is for you. Today, we're going to uncover the #1 signal your prostate is in trouble, the one most men miss, and I'll show you exactly what it means, why it happens, and most importantly, what you can do about it starting today. The prostate is a small gland, about the size of a walnut, but it plays an outsized role in a man's health. Its main job is to produce fluid that helps nourish and transport sperm. Sounds simple enough, but here's the catch. As men get older, the prostate almost always starts to grow. By the time a man reaches his 50s, more than half will already have some degree of enlargement. By their 60s and 70s, that number climbs even higher, up to 80 or 90%. Now, this growth isn't always cancer, but it can still create real problems because the prostate sits just below the bladder and wraps around the urethra, the tube that carries urine out of the body. Even a small amount of swelling can put pressure on that tube. And when that happens, the first signs are almost always urinary problems. That's why doctors often say your prostate health shows up in the bathroom first. This is the stage where many men brush things off. They figure, I'm just getting older, it's normal to get up at night. But what feels like a nuisance is actually your prostate trying to send you a warning. The biggest red flag, the one most men overlook, is trouble urinating. That might sound vague, but it usually shows up in very specific ways. A weak stream, difficulty getting started, dribbling at the end, or the constant need to run to the bathroom, especially at night. If you're waking up 2, 3, even 4 times to pee, that's not just normal aging. That's your prostate pressing against your urethra and slowing everything down. Think about it like a garden hose. When the hose is wide open, water flows freely. But if you start squeezing the middle, the stream weakens, and sometimes it sputters before it finally flows. That's exactly what happens when an enlarged prostate begins to choke off the urethra. And here's the key point. Because these changes often happen slowly, men get used to them. You might not notice your stream getting weaker until you look back and realize how much it's changed over the years. That's why so many men ignore this signal until it becomes impossible to live with, or worse, until it leads to bigger health problems. When that weak stream, hesitancy, or nighttime peeing becomes your new normal, the risks don't just stay in the bathroom. An enlarged prostate that compresses the urethra forces the bladder to work harder. Over time, the bladder wall can thicken, lose elasticity, and empty poorly. That sets you up for urinary retention, not being able to pee at all, recurrent urinary tract infections, bladder stones, and in more advanced cases, even kidney strain. Urology guidelines are very clear. Men who develop retention, recurrent UTIs, bladder stones, gross hematuria, or any evidence of kidney problems from BPH should be escalated to procedures, not just pills, because the stakes are organ damage, not inconvenience. This isn't rare. U.S. data show that benign prostatic hyperplasia and related urinary symptoms affect roughly 5 to 6% of men, 40 to 64, and 30% of men, 65 plus in a given year. And globally, cases have risen substantially over the last 3 decades as populations age. In other words, if these symptoms sound familiar, you're not alone. But that also means millions of men are gambling with the downstream complications by waiting. There's also the cancer angle. Most urinary symptoms come from benign enlargement, not cancer. But ignoring changes means you might also miss the chance to discuss appropriate screening. Current U.S. guidance recommends shared decision-making for PSA testing from ages 55 to 69, and generally against routine screening after 70. Individualize if high risk or very healthy. The key point for viewers: symptoms cancer, but symptoms do warrant a conversation with your clinician about evaluation and whether screening makes sense for you. The good news: acting early changes the trajectory. Landmark trials show that medical therapy can reduce the risk of bad outcomes. In the MTOPS trial, finasteride plus an alpha blocker significantly reduced overall clinical progression versus either drug alone, and finasteride, alone or in combo, cut the long-term risk of acute urinary retention and needing surgery. Don't tough it out. There are proven ways to lower the odds of a painful ER visit or an urgent procedure. Before we get into exactly what to do, lifestyle moves, meds, and when to escalate, remember this simple rule. Frequent nighttime urination, a weaker stream, or straining are not just age. They're your early warning system. Urology guidelines exist to keep men from crossing that line where the bladder or kidneys pay the price. The good news is, there are clear steps you can take if you start noticing these warning signs. The first place to look is your daily habits. Something as simple as adjusting when and how much you drink can make a big difference. Studies show that higher caffeine and evening fluid intake directly increase urgency and nighttime bathroom trips. By front-loading water earlier in the day and cutting back on coffee, tea, and alcohol at night, many men see fewer disruptions to their sleep and less strain on the bladder. Another surprisingly effective tool is pelvic floor muscle training. Most men think of this as something only used after prostate surgery, but research now shows it can improve symptoms even in men with benign enlargement. When combined with bladder training, learning to gradually extend the time between bathroom visits, the results are often faster and more noticeable than medication alone. That said, lifestyle and exercises are just one part of the solution. If you're having persistent symptoms, the next step is to get evaluated. A clinician can measure your symptom score, run a simple urine test, and discuss whether prostate screening is appropriate for your age and risk factors. Remember, urinary symptoms don't automatically mean cancer, but they do mean it's time for a proper conversation about your options. When it comes to treatment, medications are often the first line. Alpha blockers like tamsulosin relax the muscle fibers around the urethra, so urine flows more easily. They start working within days to weeks. 5-alpha reductase inhibitors like finasteride take longer, several months, but they actually shrink the prostate itself and reduce the long-term risk of sudden urinary retention or needing surgery. The strongest results often come from using both together. In fact, large trials like MTOPS showed that combination therapy significantly cut the risk of disease progression compared to either drug alone. For men who also struggle with erections, tadalafil, a low daily dose of the same medication used for erectile dysfunction, has been proven to relieve urinary symptoms as well, making it a 2-for-1 solution. Now, what about natural remedies? Saw palmetto is probably the most famous supplement, but high-quality studies have found little to no benefit compared to placebo. If you've been spending money on it, you should know the science doesn't back it up. Pumpkin seed extract has shown small improvements in symptoms in some studies, but overall, results are inconsistent and nowhere near as effective as prescription medications. These supplements may have a role as supportive measures, but they shouldn't replace proven treatments if your symptoms are significant. Finally, it's important to know when it's time to escalate. If you're dealing with repeated urinary retention, bladder stones, infections, blood in the urine, or signs of kidney stress, that's when urologists recommend moving beyond pills. Fortunately, modern procedures have come a long way. Minimally invasive options like the UroLift implant, Resume water vapor therapy, or aquablation can relieve obstruction while preserving ejaculation in many cases and with quicker recovery than traditional surgery. For larger or more complex prostates, established surgeries like TURP or laser enucleation are still highly effective. The bottom line is this: start with the simple levers like hydration, caffeine control, and pelvic floor training. Don't wait to get evaluated because medications can slow or even prevent progression. And if your prostate has already begun causing complications, today's procedures are designed to protect your bladder and kidneys while giving you real relief. To really bring this home, let's look at 2 very different paths men often take. Imagine a man in his early 60s who notices he's waking up 3 times a night to urinate and that his stream isn't what it used to be. He tells himself it's just getting older and does nothing. Over the next couple of years, his bladder has to work harder and harder. Eventually, one night he finds himself completely unable to urinate, a painful emergency known as acute urinary retention. He ends up in the ER catheterized and told he now needs surgery. Sadly, this isn't just a story. It's a common scenario doctors see every day. Studies confirm that men who ignore these early urinary symptoms face a much higher risk of reaching this point, where procedures become unavoidable. Now let's compare that to another man. Same age, same starting symptoms. But instead of brushing it off, he brings it up at his annual checkup. His doctor runs a quick exam, checks his PSA, and confirms it's likely benign enlargement. They start him on a daily alpha blocker, and within a couple weeks he notices his flow is stronger and he's sleeping through the night. A few months later, with the addition of a 5-alpha reductase inhibitor, his prostate actually shrinks, and his long-term risk of retention and surgery drops significantly. He still has to manage his habits, but he avoids the ER, the catheter, and the surgery. The difference between these two men isn't luck, it's timing. One ignored the signal until it became a crisis. The other recognized that weak stream and nighttime bathroom trips weren't just quirks of aging, but his prostate sending a warning. And because he acted early, he stayed in control of the outcome. So here's the takeaway. A weak stream, hesitancy, or frequent nighttime bathroom trips are not just a harmless part of getting older. They're your prostate's early warning system. Ignoring them can set you up for bladder damage, painful emergencies, and even surgery down the line. But paying attention, making small lifestyle changes, and talking with your doctor can completely change your trajectory. If you're noticing these signals, don't brush them off. Get checked, take action early, and give yourself the best chance at staying healthy and in control. And if you found this video helpful, make sure to hit that like button so more men can see it, and subscribe to the channel for more straightforward, science-backed advice on men's health. I've got several other videos on prostate health and sexual performance after 50 that you won't want to miss. I'll link them right here for you. Remember, your prostate is small, but it speaks loudly if you know how to listen. Don't ignore the number one signal it's in trouble.